I'm Lisa, and this is Mandy, and we're here with Specialty Wellness located in the Colony, Texas. And today we're going to talk about women's wellness and sexual wellness. As you know, we are a full-service med spa with a lot of aesthetic treatments, and then we're also a primary care office. But a lot of people don't know we actually offer a lot of sexual wellness treatments to treat concerns that females might have.
Yeah, so I would say a lot of women, especially as we age, they have complaints about like dryness, painful intercourse, lack of like elasticity, and then like urinary incontinence, laughing, coughing, and like that. And growing up, I watched my mom and my aunts kind of struggle with these issues, and I just thought that's what
being a girl
is. Yeah, yay for us to look forward to. But wow, little did I know, the FemiLift exists, and it can actually help these problems, these issues, quite a lot.
Yeah. A lot of people they don't know that there are treatments out there to help with what she said: incontinence, painful intercourse, vaginal dryness, vaginal itching. There's actually a very effective treatment called FemiLift that is minimally invasive, non-surgical, no downtime, very little to no pain. That's going to help treat all of those areas.
Kind of sounds too good to be true.
Yeah. It is. I mean, the way technology is going, like, we're getting so many things that are too good to be true now, and they're real.
They're just going to keep getting better. How can a FemiLift, how can a machine help with all of those issues for women?
So what this device is, this is actually the machine, the FemiLift machine. So it's a laser machine that's a CO2 energy. And basically, when we do microneedling, when we do lasers on our face, what are we doing? We're basically causing controlled injury to help your body stimulate collagen, elastin, do the whole repair process to help tighten the skin, smooth the skin, help with, pores, scars, all that. So this laser actually can be used in the vaginal canal area to do all of those things as well. So this little device goes in the vaginal canal, and this is where the energy comes out, the CO2 energy. And basically this device is in the vaginal canal, and we kind of just spin it around very gently, and it's giving off the CO2 energy all throughout the vaginal canal to help stimulate collagen, elastin, help tighten the skin, which is also going to help with vaginal dryness, help increase like lubrication, and help with any kind of vaginal maybe itching and just vaginal discomfort that comes with aging, hormonal issues, maybe children, childbirth. A lot of issues kind of stem from all of those things. Urinary incontinence, this laser is also able to strengthen the pelvic floor and the pelvic muscles that help with stress urinary incontinence. So if you're suffering from you're jumping, you're coughing, you're seizing, and you have a little bit of the urinary incontinence, this machine is going to help a lot because it's going to strengthen all those muscles and stimulate all those muscles and kind of like reactivate them again.
Kind of like going back in time.
Yeah. So again, very comfortable, no pain. Some people say it's similar to like getting like a pap smear. You actually don't feel the heat of the laser because the vaginal area doesn't really have like those kind of sensory receptors, so you don't really feel, it doesn't feel like burning. We don't need numbing cream. We don't need anything like that. You don't really feel any of that. Afterwards, there's no like pain or downtime either. We do say don't have sex or don't do intense exercise for about 3 days, just so that we can let everything heal well. But really no pain, no downtime. You could do this during your lunch hour and no one would really know what just did.
My next question is how long does it usually take this procedure?
So this procedure usually takes 10-20 minutes or so. We have you come into our room, just kind of undress from the waist down. We put a little bit of ultrasound gel on here just so it can kind of go in a little bit easier. The actual treatment is about 5 minutes, and then you're done. So it's really easy, really simple. Yeah. Then you can change, and then you're good to go. So it's really fast.
Basically, like a pap smear, except you're leaving
rejuvenated.
Yeah.
So we usually recommend doing 3 treatments spaced about 4 weeks apart, and then we kind of see how you're doing. Most patients say after the first treatment, they've already noticed increased lubrication, helping with the stress urinary incontinence, but we say to do 3, and then you can do a maintenance or touch-up session in about a year.
Okay, if they need it.
Yeah, if they need it.
Okay,
Yeah.
awesome. So Lisa, who would be a good candidate for this?
So a good candidate, honestly, is anyone who is having vaginal dryness, having vaginal kind of irritation that's not caused by like an infection or other kind of health concern or issue, or anyone who has stress and urinary incontinence. So sometimes there's like 30-year-olds who've had maybe 2, 3, 4 babies already, and they're having that urinary incontinence, or their vaginal canal is a little bit overworked and stressed, and they need that. Or there's like 40-year-olds who are having hormonal changes, and that's causing their vaginal dryness, and they're needing it. Or even like 60-year-olds, So honestly, there's not like an age minimum or limit, as long as you're having stress urinary incontinence and you want increased lubrication, you want increased sensation down there and more, and helping with the vaginal dryness, you are a candidate basically.
So if it helps with, like you said, couldn't help but notice, you said increased sensation.
Yeah.
So it can help women like sex feel better, not just like give her the pain, but actually help them feel better.
So basically it's stimulating that collagen and elastin. So it's tightening that vaginal canal. So everything feels better when it's tighter, plumper, stronger. It also strengthens the vaginal canal muscles to help with that sensation as well. So
is there anybody who wouldn't be a candidate?
the only thing we say is that we want to make sure you've had a pap smear within the last year. That's a normal pap smear, just because if you have any abnormal cells, we don't want to put a laser to it, just like with the skin. So if you have skin cancer, we obviously are not going to put a laser on your skin. So safety first, yeah. And some women are actually not candidates for artificial hormones or bioidentical hormones because of like a breast cancer risk or hereditary, or ovarian risk or uterine cancer risk. So a lot of patients who have that risk can't take hormones or can't do the pellets or can't do the creams. So they're kind of stuck. They're going through hormonal changes, they're going through menopause, and there's nothing they can do except they can do this, because this is non-hormonal, nothing implanted in you. It's literally just stimulating your own body's collagen and elastin to help strengthen those muscles, help tighten everything up, and help kind of resurface like the vaginal area. So this is a great safe treatment, and honestly a more like natural way to help with those premenopausal, menopausal symptoms that a lot of women suffer for. And again, no hormones, no medications, just like your own body repairing itself. So, but yeah, it's a great treatment. No downtime, no pain. That's really going to help with female sensation, lubrication, tightening the vaginal area, and then bonus is the stress urinary incontinence.
Love that.
Yeah.
So I've also heard that if, some women, they struggle with repetitive like yeast infections or bacterial vaginosis, and that's, those are commonly caused because your pH is imbalanced.
Right.
And, they do the medications, they even do probiotics, they're trying to do all the things. Still, they struggle. I heard this can help.
It can actually.
That's amazing.
Right. So those type of infections are not caused by, they're not STDs. Basically, it's just like your own body's pH and flora is not balancing properly. So this actually can kind of like stimulate, again, the whole repair process of the vaginal area and kind of make your vaginal canal like work better and more efficiently function at its peak.
That's perfect.
Yeah.
So if someone had those issues, could it be covered by insurance?
Unfortunately, no.
They're not caught up with us, are they?
It should. But yeah, this is a non-insurance kind of cash pay pricing. But we do have a lot of good packages and a lot of good pricing. So please call us, text us, message us, and we can definitely give you more info on that.
So what about if they had a baby, when is the soonest they could get this treatment?
So we definitely want them cleared by their OBGYN, but typically 3 months, everything is good and healed down there, and they can start doing this treatment if they feel like they're having the urinary incontinence or, dryness or anything like that. All right. Thank you so much for joining us as we talked about FemiLift and a woman's sexual wellness today. I'm Lisa and this is Mandy, and please feel free to call us, DM us, text us, all that, so we can schedule a consultation with you.
All right. Bye, beauties.
Bye, beauties.